We have a number of decades of evidence from a range of different countries that tell us about the health harms of secondhand smoke exposure.
A review was conducted by colleagues at Aberdeen University that demonstrated unequivocally that there were up to 1,000 deaths associated with smoking, secondhand smoke every year. And also there were considerable ill health effects, heart disease, respiratory disease, and also lung cancer.
And if you think about the occupational groups that would be most exposed to secondhand smoke, bar workers were a key group for government because obviously they're working in a smoking environment. So they commissioned a study on bar workers' health. And what they found is when they compared pre-legislation to after the law, there was an 81% improvement on average across the pubs that they measured in the quality of the air. They also looked at the respiratory health of bar workers, and they found that those who had any pre-existing conditions or were experiencing respiratory symptoms, that those improved after the legislation was introduced.
And in terms of health, we found really a population level reduction, about 40% reduction in adults and in children. This then we think is responsible for a reduction in heart attack. There was a 17% reduction in the year following the introduction of the ban.
And that equated to 1,200 fewer emergency admissions for heart attacks in the year following the legislation. So that was an immediate impact.
One of the really surprising things we found was there were quite dramatic perinatal outcomes. We found a reduction in low birth weight babies and preterm babies. The reason we think this happened was that around the ban, just in the period leading up, mothers who were pregnant actually saw all the information about secondhand smoke. They actually saw information about getting assistance for quitting smoking as well, and this influenced their smoking behaviour.
You would think that if you introduce a smoke-free law, people might smoke more at home around their children because they can't do it so much in a public place. The studies in England and indeed elsewhere showed that didn't happen.
I think the cultural shift is also terribly important. It has now become unacceptable to smoke in front of others, and I think that cultural shift actually means that the improvements will be sustained.
So overall, what we can say, again for the many countries that don't have laws like this, is there's plenty of evidence from the UK that adds to existing international studies about the benefits of smoke-free legislation that can provide more confidence about the fact that if you do introduce this, it will have positive results.